Hi, I'm Dr. Craig Castanet of Baxter Clinic. I'm going to talk to you about pinched nerve treatment today. When you have a pinched nerve, it's usually in the neck, in which case it'll radiate into the shoulder blade, sometimes the mid-back, and down the arm. You may get tingling, numbness, weakness of the hand and arm if there's a nerve pinched in the neck. The quality of the pain could be burning, sharp, dull, achy, any number of sensations, but the point is the distribution is going to be somewhere into the shoulder and down the arm. When you have a pinched nerve in the low back, the pain is typically going to radiate into the buttock, the thigh, and then the leg beyond the knee. In either case, the way you want to treat these things is to use a treatment that we offer here. It's non-surgical. It's called spinal decompression. Let me go to a model for a moment. I'm going to use this model right here to explain what's going on in a pinched nerve. Pinched nerve is typically pinched because of some disc-related problem. The discs are the cushions between the bones. The cushion or disc is made up of two components. There's a tough fibrous ring, multiple layers of it, that enclose a gelatinous substance in the center of the disc. As these wear out over time, they can permit the inner part to migrate out through the back part of the disc. That may hit the nerve root behind it. Sometimes in the neck it may affect the spinal cord as well. But if it hits the nerve root in either the neck or the low back, then you'll start to get symptoms radiating beyond the neck or low back into the arm in the case of the neck, or into the buttock and leg in the case of the low back. So the way we treat these things is we place a person on the table, a spinal decompression table. We have them lay face up. It's a very gentle and easy process. We secure the person to the table, and then the table gently and slowly separates the vertebrae to get pressure off of the disc, the nerve, and the joint. This lasts for about a half an hour. It gets more water, oxygen, and nutrients into the disc. It takes pressure off of the disc by separating the vertebrae. That encourages the disc bulge or herniation to migrate back from whence it came and to take pressure off of the pinched nerve. Generally, you can expect to get relief with the first treatment to some extent. 60 to 70% of people will get some relief the first time we do a treatment, and then as we increase the process with more treatments and increasing the amount of the tension or decompression, they get typically progressively more relief as we go through the process. Some people respond and resolve their problem fairly quickly in 2 to 3 weeks. Others may take a longer period of time. If it's a severe problem, could take as long as 8 to 10 weeks and occasionally more. But it's the best treatment I've seen non-surgically for disc-related problems and pinched nerves as a result of that. You can also do epidural steroid injections. I have a video clip on that as well, instructing you about epidural steroid injections. But I would always first mechanically improve the problem to improve your symptoms, because most of the time if you do that, you won't need to undergo injections. So that's how we treat pinched nerves. Thank you.